But in everyday medicine, people are sent down paths of care by factors that they may not think to consider. The doctor who happened to be working in the ER the day they sprained their ankle, or the patient they happened to share a waiting room with just prior to a routine doctor's visit. It's not good luck to sprain your ankle on a Tuesday or bad luck to sprain it on a Wednesday. It's as random as a roll of the dice. Yet, the day a person sprains their ankle may determine which doctor happens to treat them in the ER, and thus the likelihood they're prescribed an opioid pain medication that could lead to long-term use. Because opioid prescribing tendencies vary from doctor to doctor, as one important study demonstrated, the doctor you happen to see can have lasting repercussions. Similarly, it's not inherently good luck or bad luck to share a doctor's office waiting room with someone. But if that person happens to have a viral infection, a chance encounter could lead to a bout of the flu 2 weeks later. And especially for the very young and the elderly, the flu is no laughing matter. In this book, we're going to explore the hidden but predictable ways in which chance affects our health and our healthcare system. We're going to do it by diving into real research conducted by ourselves and others. We'll examine what happens to patients when the doctor they expect to see in an emergency can't be at the hospital, and why they may be better off with a substitute. We'll look at why meeting a surgeon just before a big birthday versus just after can affect major surgical decisions, and why this phenomenon can be explained by well-known grocery store pricing tactics. And in an era when healthcare is becoming increasingly politically polarized, we'll see whether the politics of the doctor who happens to care for you in the hospital matters for the care that you receive. Beyond just making observations, we're going to look at what these occurrences can teach us about what works and what doesn't in healthcare today. Because while we can't remove randomness from our lives, we can learn from it, so we don't become victims of chance. Economists, epidemiologists, and social scientists sometimes talk about natural experiments. Natural experiments are natural because they occur without the influence of any manipulating hand. One person grows up in one zip code. Another grows up across the street, which happens to be in a different zip code. One baby is born into a season of drought. Another is born during record monsoons. There is no researcher designing a study, no patient signing up to participate, no new medical intervention being intentionally tested. These are conditions for accidental experiments, science occurring in the wild. Natural experiments run in contrast to what we might think of when we use the word experiment. In medicine, randomized controlled trials, the gold standard of science where researchers randomly assign subjects to either a treatment or a control group and then follow them into the future, are our most powerful and preferred tool for studying cause and effect. They are our best way of knowing whether an intervention really works. These are the studies that have been used for decades to prove the efficacy of the blood pressure drugs, cancer therapies, and vaccines we use today. But randomized controlled trials aren't perfect. They can be logistically difficult, expensive to perform, take unreasonable amounts of time, or be flat out unethical. Imagine you are interested in studying the effect of air pollution on human health. A scientist couldn't simply assign human test subjects to regions with different levels of air pollution and observe the results. Or imagine you wanted to study the long-term effects of screen time on children. Assuming you could surmount the complicated ethics of such a controlled study, you might still have to wait dozens of years to see results, at which point your study might have ceased to be relevant. So, researchers in some fields, economics in particular, have come to rely on natural experiments in their work. How so? Let's circle back to air pollution. You can't just purposefully expose people to air.